Hello everyone, welcome to this channel. In my last video, I talked about thymus gland. If you have seen that video, then click on the button and watch the video now. Today I'm going to talk about our next part of the endocrine system, which is thyroid gland. Okay, as you can see in this photo. So it's the endocrine gland having two lobes, right lobe, left lobe, and both are connected by isthmus and present in the throat. Okay, so the extension is actually, it is above the trachea. I mean, it starts from C5 to T1. I mean C5, C6, C7 cervical vertebra, and then first thoracic vertebra. Okay, T1. So this is the original position of the thyroid gland, and each lobe, I mean right lobe, left lobe, both lobe extends up to the fourth or fifth tracheal ring. Okay. Now in measurements, it is actually almost 5 centimeter in length, 2.5 centimeter in broad, and also 2.5 centimeter it is thickness, and the average weight is ranges from 25 to 30 gram. Okay. Now in females, it is little bit larger than male. Also in pregnancy, the size of the thyroid gland increases. Okay. Now as you can see in this photo, at the perspective of each lobe, it has apex, base, also it has lateral surface, medial surface, posterolateral surface, along with anterior border, posterior border. Finish. The apex of this thyroid is directed upward and little bit laterally. Okay. Now at this point, it is connected with the sternothyroid muscle to the oblique border of the thyroid cartilage. Okay, and related with the superior thyroid artery along with the external laryngeal nerve. Now as I said, the base extends up to fourth or fifth tracheal ring. Along with it is related with the inferior thyroid artery and recurrent laryngeal nerve. And now the lateral border of this thyroid gland is covered by sternothyroid muscle, and also superior belly of omohyoid muscle and the anterior border of the sternocleidomastoid muscle. Okay, the medial surface is related with the trachea, esophagus, inferior constrictor muscle, cricothyroid muscle, along with external laryngeal nerve and recurrent laryngeal nerve. Okay, now the posterolateral surface is related with the carotid sheath and common carotid artery. Okay, and the anterior and posterior both border is related with the branches of superior thyroid artery and inferior thyroid artery. Okay, that's it. Now as I said, both lobes are connected by isthmus, so you have to know about this isthmus part also. It has anterior surface, posterior surface, superior border and inferior border. Okay, now the anterior surface is related with the sternohyoid and sternothyroid muscle, I mean both sides. Okay, left side, right side, along with anterior jugular veins and then fascia and then skin. Also the posterior border is related with the second, third and fourth tracheal ring. Okay, now the upper border of the isthmus is related with the anastomosis of right and left superior thyroid artery. Also the inferior border of the isthmus is related with the right and left inferior thyroid vein. Now main thing, blood supply. As always, it has two component, arterial supply, venous drainage. In arterial supply, you are getting from superior thyroid artery, inferior thyroid artery, also accessory branches from esophageal arteries, gone. And the venous drainage is done by superior thyroid vein, middle thyroid vein, inferior thyroid vein to the internal jugular vein. Okay, that's it. The nerve supply of this thyroid gland has mainly coming from middle cervical ganglion and also few branches from upper and lower, I mean superior cervical ganglion and inferior cervical ganglion. Okay, this thyroid consists of two types of cell. One is follicular cell and another is parafollicular cells. Okay, follicular cells produces T3, T4, I mean triiodothyronine and also thyroxine. Okay, now what are these hormones function, I will talk about later in physiology chapter, not here. And this parafollicular cells produces thyrocalcitonin hormone, which I'm going to talk about later, not now. So these are the little bit microanatomy. So this thyroid has major influence in our body metabolism, and along with these related with lots of disease. I will going to talk about this later, not now. So this is all about our anatomy of thyroid gland. I hope you a little bit understand. So you can subscribe and share. Till then, bye.